Excellent. Nice. Oh wow, so many people coming in, so that's good. Excellent. So welcome everybody. It's so amazing to have you all with us on this wonderful day that is International Women's Day. And I think it's like, whilst we are so aware of the women's issues, I think having a day dedicated to really focus and talk about it is essential in today's time. We're so pleased to be hosting today's special web cafe in partnership with Oxfordshire Sexual Abuse and Rape Crisis Centre. We know that there are many barriers for someone reaching a sexual abuse service. We also know that there are many additional barriers for someone from minoritized community reaching a sexual abuse service. So meaning far too many victims are not getting the support that they need. So today we have two wonderful experts who will be talking to us about these barriers and how services can work to overcome them. So we have our speaker Naseem, who is an experienced psychotherapeutic counsellor and counselling in groups manager and clinical supervisor for OSARC. She's registered with the British Association for Counselling and Psychotherapy and the Black, African and Asian Therapy Network. She has a knowledge of cultural diversity in hard to reach communities and language skills in English, Hindi, Punjabi and Urdu. Naseem's areas of interest and experience include child sexual exploitation and honor-based abuse. Naseem is also a trustee for Oxfordshire, which we're very proud of. So thank you, Naseem. Our speaker as well is, our second speaker is Fatou. She's a passionate and dedicated gender activist who is known for her work in the Bema communities to end FGM, domestic violence and other harmful practices. She has worked extensively with vulnerable Bema women, including refugees, asylum seekers and migrants during her previous role at Oxfordshire Domestic Abuse Services as Domestic Abuse Outreach Officer and at Refugee Resource as Women's Service Coordinator. As a survivor of FGM herself, Fatou adds a powerful and authentic voice to struggle to end FGM and other gender-based violence issues. In her current role at the City Council, Fatou looks at barriers to accessing health and well-being services, particularly for minorities groups in the city. We're very pleased to have Fatou with us as well. So thank you so much, both of you. I think we've got everybody, and I saw somebody come in, but they've been admitted, so that's great. So just to start off with our first question, I'd like to know if you can tell us a bit about the barriers to sexual violence services that anyone might face. Either Naseem or Fatou, you can start.
Okay, I'll start. I'll kick off. So the barriers generically for anyone, for any female accessing sexual abuse services, range from the general shame under being believed, whether they're going to be believed by whomever they discuss it with, and the taboo and stigma that's attached to being a victim of sexual abuse, rape, or any form of violence.
Thank you. How about yourself, Fatou?
Yeah, just to add on to what Naseem has said, I think from the work that we've done on the ground at the council, a lot of patients or individuals have talked about the lack of trust, and that's general, not just limited to the sexual abuse services, but also like healthcare services in general, is that lack of trust, and that can be because of the experiences they have faced in the past. It could be because they've been let down in the past, or it could also be the systemic biases, the stereotypes in the system. So trust has been a major barrier among residents or individuals accessing healthcare services in general.
And so that's something that anyone might face when they're trying to access services. So what about the additional barriers that someone from a minoritized community might face? So for example, like I was saying, trust, but is there a deep